Hello, Thales Innovation Judges. In an age where healthcare opinions are abundant and information is at the tips of our fingers, making an accurate and informed decision can be a monumental task. Today, we present a creative solution to precisely categorize big data and provide healthcare practitioners resources for patient-centered care. We are the neuroscience team.
My name is Megha Verma.
My name is Kartik Pradeepan.
And my name is King Fan Liu. And today we will be showcasing our idea of using machine learning algorithms to form something we call opinion galaxies to effectively visualize all of the opinions and associated evidence in healthcare to help clinicians and patients make better decisions. Unfortunately, not all illnesses have simple treatments as common infections do. Many diseases such as cancers, neurodegenerative disorders, mental illnesses, and dementias are complex and require multifactorial treatments. For example, a common opinion regarding Parkinson's disease treatment is to use L-DOPA or dopamine supplements. However, patients are also recommended deep brain stimulations to manage symptoms. In addition, issues like mental illnesses have a plethora of treatment options. One drug, such as risperidone, can affect two different patients with the same clinical diagnoses like schizophrenia in different ways. Today, there are so many research labs around the world coming up with creative ways to treat complex diseases. Results from these labs are opinions based upon different aspects such as genetics and environmental factors. It is inevitable that there is overlap in the research. It is impossible that any one clinician would be able to efficiently stay up to date on all of these opinions. Another example involves cancer patients who commonly develop mutations and resistance to therapies and require new treatment options. Finding the most effective treatment option from a sea of opinions derived from clinical trials and pharmacological research is critical to improved patient outcome. Currently, physicians and healthcare practitioners need to carefully consider and critically examine literature and results from clinical trials to identify new treatment options. This is a massive time commitment. The rate of new publications provides a plethora of information that needs to be critically appraised. Even a specialist in the field will struggle to determine what papers are impactful, what papers have the strongest translational evidence to clinical applications, and most importantly, what opinions are trustworthy when patient lives are on the line. This process of categorizing and determining robustness of opinions can be automated using artificial intelligence to provide healthcare practitioners resources for the best patient care. A study by Velo and Minuz in 2009 investigated medication errors, prescribing faults, and prescription errors. They identified that inadequate knowledge or competence and incomplete information about clinical characteristics and previous treatments of individual patients as one of the leading factors in inadequate patient care. Recent meta-analysis show that the range of errors attributable to junior doctors who are responsible for most prescriptions in hospitals can vary from 4.2 to 80% of patients. To combat these errors, AI can be used to categorize medical opinions expressed in publications and determine the robustness of the findings, both providing insight as well as a method of double-checking treatment options. The first obstacle is developing systems that can collect all information related to a certain illness or drug. Software such as web scrapers currently exist that can be implemented to extract specific information from publications from medical search engines such as PubMed. These web scrapers can efficiently create new databases of papers from life science and biomedical topics. The accuracy and speed of the categorization surpasses any one human's ability. Examples of current web scrapers include Publish or Perish, or Gresper. In essence, web scrapers create a database in a format that network and visualization tools can use to make the network using keywords and other parameters from the papers.
Once we have the papers in a database, we need to make a network that links the papers together in a meaningful way. Word2Vec and thought vectors offer an innovative way for a machine to read for us. This has been used to categorize Wikipedia articles in the past. Words are linked by grammar and thoughts are a logical path of words. Essentially, thought vectors can measure the similarity of how words in one paper are used to the words in another paper. Vector math can be used to give you abstract representations of the meanings of words. For example, king minus man equals royalty. Royalty plus woman equals queen. The vector offset is the subtraction that we just did, and this tells us the relational meaning of words. The thought vector's unsupervised learning algorithm does this on a large scale for the entire paper and connects the papers, or nodes, based on their meanings. With a rendering engine, we can use that data to make our interactive opinion galaxy visualization, where each node is a paper with a distinct opinion. What does this visualization look like? Well, it will look like this. Statistical algorithms can be used to reduce the dimensions of data into a 3D environment like a galaxy. Each star in this galaxy is an individual node representing a paper, and it is clustered with other nodes that have similar contextual meaning. In a network, the line linking nodes together is called an edge. More similar nodes have shorter and stronger edges that make tighter clusters. Using this, you can visualize clusters of thoughts, i.e., an opinion cluster, and all related sources of thoughts and opinions in that cluster. For example, similar opinions about treatments that use similar experimental techniques are clustered more closely together. This removes the bias that regular PubMed databases present, where it continually shows the reader the similar papers using similar techniques, and the clinician may miss out on other treatment options. Visualizing the entire network for research permits us to see the entirety of research in a field and thus all the different opinions available. But which opinions are more important than others? Which clusters are more relevant? How can we tell which opinions have more credence and which are based on more dubious evidence? Nodes that are in the middle of the cluster and with more connections to other papers are the ones that are more likely to use most diverse set of experimental models and analysis techniques and have more connections to research areas in that field. The citation number will also tell the physician how commonly each idea has been explored or implemented in the past. Nodes that are far away from the center of the cluster, or peripheral nodes, have less evidence or less replications of experiments, less statistical power, and are less frequently cited by other papers. This is why their nodes have fewer connections to other nodes. A clinician may save thousands of hours of reading and careful consideration of current research to be able to find the most relevant papers to his patient care.
Using the application of 3D visualization, two potential applications are virtual reality or computer navigation of this environment. Imagine you're a doctor stuck between potential treatments for a disease. You put on some VR glasses, and all of a sudden you're immersed in this opinion galaxy environment that was generated by scraping all the information related to that disease. You can move forward, back, left, and right, navigating your way through this opinionated landscape. As you approach a cluster, a box pops up giving you a summary of that opinion cluster. But being a skeptical doctor, you want to get a better understanding of what led you to the basis of that opinion. You move into the cluster, physically touching the nodes. You receive a summary of the robustness of that paper and are able to save time by getting to the right paper quickly enough to investigate that treatment specifically and save time. If we look at that image, we can clearly identify many nodes, or papers, or pieces of evidence that have clumped together based on their thought vector, or relative contextual meaning. If the following galaxy was produced from all the information related to a specific drug, each cluster would represent a specific opinion related to that drug. Because a single drug can be used to treat multiple diseases, it would make sense to see so many different clusters. Large distances between clusters could indicate opinions that are very different, perhaps due to a drug's treatment of very different diseases. You can find the specific content of the opinion summarized as you approach the cluster and by further interacting with individual nodes. Now zooming into the cluster in the bottom right corner, on the other hand, clusters that are closer together could indicate differing opinions of a specific drug as a treatment for a certain disease or a similar disease. You can see the nodes that almost look like they're converging. These could be papers that suggest a new idea or a confounding factor that led to opinions diverging, almost like an evolutionary event that led to the diverging of two species. By also looking at opinion galaxies over a time series, which you can do by only looking at papers within a certain time frame, you can determine when and how a prevailing idea eventually spin to two opinions. This would give insight into scientific progression of a topic and help clinicians understand how an opinion came to be. Each white event is an opinion. Each red event is a paper that caused a splitting into two opinions. Papers belonging within the same branch would be clustered together initially, but as more papers accumulated on different branches, the opinions would split further as time went on. In 2003, we would see two distinct opinions. In 2010, we would see 4 opinions, and in 2018, we would see 6 opinions. Similar to an evolutionary tree, opinions can further diverge or even come back to converge into a single all-encompassing opinion. Overall, this visually helps anyone get better insight into big data to gain a deeper appreciation for the complexity of ideas that they're faced with when making decisions.
From big data to opinion galaxies within the universe of a topic, network visualization allows a level of flexibility to evaluate scientific data that no single review paper or meta-analysis can hope to compete with. Meta-analyses compound errors from different studies and often ignore or mitigate differences in the methods. Review papers simply cannot keep up with the pace of research. Our opinion galaxy is a dynamic visualization strategy that organizes opinions into clusters of different opinions based on contextual meaning and weighs the robustness of each scientific opinion appropriately. This sophisticated strategy is the future of medicine that is no longer burdened by the constant new research findings, ideas, and their interpretations, but rather lifted and strengthened by it thanks to the concepts of machine learning and continuous improvements in computation. How decisions are made in the age of overabundance will never look the same again. Thank you.